Hello beautiful people, welcome to my YouTube tutorial. In this section I'm going to be discussing pharmacology of anti-seizure drugs, and my objective today, I have the types of seizures, then the modes of action of anti-seizure drugs. So under seizure, this is the repetitive firing of neurons in a localized area in the brain, and usually the area of the brain will depict the symptoms or the signs that we'll see in the patient. So under seizures we have partial and general. Partial the same as focal or local. Under this we have simple and complex or petit mal. In general we have absence, atypical, atypical, then tonic, which is also grand mal, and this is tonic chronic, and then also have tonic. So with the modes of action we shall see ion channels, drugs that affect the ion channels, then those that affect the synaptic inhibitory, sorry, the synaptic inhibitors. So therefore, to begin with the partial seizures, these usually occur in a localized area in the brain. For example, it can occur in the frontal, occipital, temporal, or parietal. So any of these regions have a different signs that we shall see in a patient. Like for example, in the frontal, this involves the motor, so involves the movement of muscles, contraction and relaxation. In the occipitals are about visual. So we shall see most of the side effects of these anti-seizure drugs, such as nystagmus, is because of that. Then the temporal, under temporal, we have a number of signs that we shall see, such as fear, anxiety, hallucinations, strange smells, and others. So hallucinations, fear, anxiety. Then with the parietal, it's all about the sensory. So this we look at pain. So basically, a seizure can occur in any part of the brain, and this will depict different signs. So and therefore seizures occur due to maybe deprivation of oxygen or a trauma or any other neurological condition that may distort the normal functioning of the brain nerves. So therefore, to jump in these types of seizures, under simple seizures, we see that the person is conscious and they know what is really going on during the seizure, and it does not involve any movement of muscles. So, and it can occur for like about 1 to 30 seconds. Then under complex seizure or the petit mal, this occurs, first of all, the patients are unconscious. They do not know what's going on during the seizure. They cannot respond to any stimuli or any simple commands, and usually involves movement of muscles. So if this type of seizure begin from, let me say, the hand and progresses to the leg on the same side, we call that the Jacksonian jerk. So if the Jacksonian jerk progresses to the other part of the body, then we get what we call a generalized tonic seizure. So under general, we have absent seizures. These are sometimes misinterpreted as daydreaming because the person does not know what is going on, is unconscious, and it involves movement of the eyes or any other part of the body. And if it occurs for a very short time, we say it's typical. If it occurs for a very long time, we say it's atypical. Usually when you're using the EEG or the MRI, under typical, it lasts for around 3 hours, the frequency, whereas for this atypical is about 1.5 to 3 hours. So this has a very fast onset and stops immediately, whereas this takes long to begin and also takes long to stop. So with the tonic chronic seizures or the grand mal, this is when the nerve fibers from a local area progress to the all cells in the brain. So when all the cells get excited, we are going to see a bunch of all these side effects, of all these signs that we've seen here. So we shall have a lot of movement. Sometimes visual, we can have the patient moves eyes up and down and across, and also it may involve any autonomic symptoms. And lastly, with tonic, this is very common in children, and it involves contraction and relaxation of muscles. and this usually leads to falling down of if a child is standing. These occur when the child is conscious, and they occur for a very short time. So with general seizures, they say that usually they occur in at a specific area, especially the absence seizures. They occur. They say that their origin is within the thalamus, and the thalamus has what we call intrinsic fibers, that cells that do initiate their own action potential with the help of the calcium channels, the N calcium channels. So under this, we shall see the drugs that really target this type of seizures, the absence seizures. So therefore, to jump into the next section, we have the ion channels under the mode of action. So we have a bunch of drugs that target this. So since during seizures there is repetitive firing of nerve fiber of the neurons in the brain, so these drugs target those cells, those nerve cells that are very active, that are actively firing these that bring about these seizures. So therefore, we have the hydantoins, the immunostilbins, and then the succinimides. So under the hydantoins, we have phenytoin, fosphenytoin, mesfonytoin. Then immunostilbins, we have the carbamazepines. Then the succinamides, we have the ethosuximide. So this ethosuximide is very good at inhibiting the calcium, the N calcium channels that can be used in absence seizures. Then these phenytoin and carbamazepine, those are very good first-line drugs that we use in seizures. So as we shall see in the next chapter, we shall concentrate more on these. So under drugs that act on the synaptic inhibitory or excitatory, we have the GABA and glutamate. So GABA is an inhibitory neurotransmitter, whereas glutamate is an excitatory. So GABA is a gamma aminobutyric acid, and it has receptors. They have receptors A and B. So we shall focus on receptor A. So under these receptors, we have a bunch of drugs that work on that. So we have benzodiazepines. We have the barbiturates. We have other drugs that do not work on receptors, but prevent work on the metabolism of GABA, reuptake of GABA, such as tiagabalin. This blocks the reuptake of GABA, hence increasing the concentration of GABA in the synapse, hence more GABA effect. We have other drugs like gabapentin, which inhibits the metabolism of GABA. So under this, we shall see a bunch of drugs. Then, whereas drugs under the glutamate, the excitatory neuron, so these are going to inhibit the action of glutamate. So we have glutamate has two types of receptors: the N-methyl D aspartate, and also the L-alpha amino 3-hydroxy 5-methyl 4-isoxazopropiate. So these two types of receptors have different drugs that bind there. So we have the NMDA, we have the formoterol. Then AMPA, we have drugs like topamate or the Topamax as the brand. So therefore, this is the brief introduction of anesthesia drugs. In my next chapter YouTube tutorial, I'm going to be focusing more on the ion channel drugs that work on the ion channel, and lastly, drugs that act on the synaptic inhibitory centers. So thank you very much for tuning in. Catch you next time. Bye for now.